An acoustic neuroma is a benign tumor of the vestibular nerve. This is the nerve that carries signals from your inner ear to the brain, and it tells your brain when you are turning your head. It's a fairly common tumor. It occurs in 1 in 100,000 people, and it's the second most common tumor inside the head. Everybody's at risk for an acoustic neuroma. They tend to occur in midlife. They're also very common in elderly people. Very rarely you'll find an acoustic neuroma in a child. If you do, it's usually because they have a genetic disease called neurofibromatosis type 2. This is much less common than what is typically found, or sporadic acoustic neuroma. Sporadic acoustic neuroma has no known risk factors, and they don't tend to run in families. The vast majority of acoustic neuroma are not hereditary. Most are simply called sporadic, and we don't know what are the risk factors for acoustic neuroma. There's a very rare condition called neurofibromatosis type 2, where acoustic neuroma can happen on both sides. It tends to occur in children, and that is familial. Acoustic neuroma, or vestibular schwannoma, which is another name for the same thing, are not cancer. These are benign tumors of the cells that line the vestibular nerve fibers, called Schwann cells. The cells multiply, and they multiply out of control. They do not metastasize like cancer. They don't spread to other parts of the body. They simply multiply and build up, and so you get a larger and growing tumor over time. Acoustic neuroma can affect people of all ages. The most common form are sporadic acoustic neuroma, which occur in midlife. Occasionally they're found in elderly patients. It is very rare to find an acoustic neuroma in a child, but when one is found, it's usually because they have a rare genetic disease called neurofibromatosis type 2.